If you take amlodipine, losartan, or lisinopril for blood pressure, there is something important I want you to understand before your next dose. Not because these medicines are bad, not because you should be afraid of them, and definitely not because you should stop taking them on your own. These medications help millions of people protect their heart, blood vessels, kidneys, and brain from the damage that high blood pressure can cause over time. But here's the problem. Many seniors take these pills every single day without fully understanding what to watch for. They know the name on the bottle, they know what time to take it, they may even know the dose, but they may not know what the medicine is actually doing inside the body, which side effects should be mentioned to a doctor, which symptoms need urgent help, and which everyday habits can quietly change how safe the medicine is. That is what we are going to talk about today. Here at Sharp 50s, we focus on simple, careful health information for adults who want to stay independent, informed, and confident as they age. And in this video, I want to explain 7 things many seniors should know if they take amlodipine, losartan, or lisinopril. But please hear this clearly. This video is for education only. It is not personal medical advice. Do not stop, skip, double, or change your blood pressure medication unless your doctor tells you to. Blood pressure medicines work best when they are used consistently and safely under medical guidance. The goal today is not to make you afraid. The goal is to make you prepared. The first thing to know is that these 3 medicines are not the same. Amlodipine, losartan, and lisinopril may all be used for blood pressure, but they work in different ways. Amlodipine is a calcium channel blocker. In simple terms, it helps relax blood vessels so blood can move through them with less resistance. Lisinopril is an ACE inhibitor. It works on a hormone system in the body that can tighten blood vessels and raise pressure. Losartan is an ARB, which stands for angiotensin receptor blocker. It works on a related system but in a different way. Why does that matter? Because different medicine types can create different patterns. A side effect that is common with one may not happen with another. A warning sign that matters for one medicine may not mean the same thing for another. So the name on your bottle is not just a name. It tells your doctor and pharmacist what family the medicine belongs to and what kind of monitoring may matter for you. The second thing to know is about swelling with amlodipine. Many people taking amlodipine notice swelling in the ankles, feet, or lower legs. Sometimes socks leave deeper marks than usual. Shoes may feel tighter by the afternoon. The legs may feel heavy, full, or puffy after standing or sitting for a long time. This can be frightening because many people immediately worry about heart failure, kidney problems, or poor circulation. And sometimes swelling does need medical evaluation, especially if it is sudden, painful, one-sided, linked with shortness of breath, chest discomfort, or rapidly getting worse. But amlodipine itself is also known to cause swelling in some people. The important thing is not to guess, and not to silently suffer. If you notice swelling after starting amlodipine, or if swelling becomes worse, tell your doctor. There may be options. Your doctor may review the dose, timing, other medications, salt intake, activity level, or whether a different plan fits your body better. But do not stop amlodipine on your own because your ankles are swollen. That can allow blood pressure to rise again quietly. The safe move is simple. Notice it, write it down, tell your doctor. Do not panic, and do not self-adjust. The third thing to know is about lisinopril and cough. Some people taking lisinopril develop a dry cough. Not a wet cough. Not a cough that brings up mucus. More like a dry tickle that keeps coming back, sometimes worse at night. The tricky part is that this cough may not always appear on day 1. It can show up later, after someone has already been taking the medication for a while. So people often blame allergies, dust, weather, acid reflux, or an old cold. And sometimes those things really are the cause. But if you take lisinopril and you develop a persistent dry cough that does not seem to go away, it is worth mentioning to your doctor. Again, do not stop the medicine yourself. Just connect the dots and bring it up. You can say, I take lisinopril and I have developed a dry cough. Could this be related? That one question can save months of confusion. Now there is another lisinopril warning that is much more serious. If you take lisinopril and you ever develop swelling of the lips, tongue, face, throat, or trouble breathing or swallowing, treat that as urgent. Do not wait until tomorrow. Do not try to sleep it off. Do not assume it is just an allergy that will pass. Seek emergency help. This kind of swelling can be related to a serious reaction called angioedema. It is not common, But it matters because swelling around the throat or tongue can become dangerous quickly. So remember the difference. A dry cough is something to discuss with your doctor. Swelling of the lips, tongue, face, or throat is urgent. That distinction is important. Now before we continue, if this is helpful so far, please tap the like button. It helps this video reach more seniors who take blood pressure medication and may need this information. And in the comments, tell us your age and where you are watching from. Are you 68 in Florida, 74 in London, 81 in Toronto, or 77 in Sydney? The sharp 50s community feels stronger when people see they are not alone. And if you take Amlodipine, Losartan, or Lisinopril, you can also comment the word blood pressure. You do not need to share private medical details. Just let others know this is a topic many people are dealing with. The fourth thing to know is about potassium. This is especially important for people taking Losartan or Lisinopril. Both of these medicines affect a blood pressure system that is connected to kidney function and potassium balance. Potassium is a mineral your body needs. It helps muscles and nerves work properly, including the electrical system of the heart. But too much potassium in the blood can be dangerous. Here is where many seniors get caught off guard. Potassium is not only in bananas, it can also be in salt substitutes. Many products sold as low-sodium salt alternatives replace sodium with potassium chloride. That may sound healthy, especially for someone trying to reduce salt for blood pressure. But if you take Losartan or Lisinopril, you should not start using potassium-based salt substitutes unless your doctor says it is safe for you. This does not mean potassium foods are automatically bad. It does not mean you should become afraid of vegetables, beans, potatoes, or fruit. It means you should not make big potassium changes without medical guidance, especially if you have kidney disease, take multiple blood pressure medicines, take a water pill, or use supplements. The safe question is simple. Doctor, should I avoid potassium salt substitutes with my blood pressure medication? That is a very smart question, and it is much better than guessing. The fifth thing to know is what illness can do to your blood pressure medicine. This is something many people never think about until it happens. Imagine you have a stomach bug, you are vomiting, you have diarrhea, you are not eating well, you are not drinking enough, or maybe it is a very hot week, you are sweating more, and your fluid intake is lower than usual. Your medication did not change, but your body changed. When the body becomes dehydrated, blood pressure can drop lower than expected. The kidneys may also become more vulnerable, especially in older adults or people who already have kidney issues. This matters for medicines like Losartan and Lisinopril because they work closely with the blood pressure and kidney regulating systems in the body. It also matters if you take a water pill, sometimes called a diuretic, along with your blood pressure medicine. Now, this does not mean you should make your own sick day rules. It means you should ask your doctor for a plan before you need one. At your next appointment, ask this. What should I do with my blood pressure medicine if I have vomiting, diarrhea, fever, heavy sweating, or cannot keep fluids down? That question is simple, but it can be very important. Your doctor may give you instructions based on your health history, kidney function, blood pressure readings, and the exact medicines you take. Do not wait until you are weak, dizzy, and dehydrated to ask. Make the plan while you are well. The sixth thing to know is about over-the-counter pain medicines. Many seniors take blood pressure medicine and also use pain relievers for arthritis, back pain, knee pain, or general aches. The problem is that some common anti-inflammatory pain medicines, such as ibuprofen or naproxen, can affect kidney blood flow, especially when combined with certain blood pressure medicines or dehydration. This does not mean every person can never use them, but it does mean you should not assume that over-the-counter automatically means harmless. Your kidneys do not care whether a medicine came from a prescription bottle or a drugstore shelf. They respond to the chemistry. So if you take Lisinopril or Losartan, especially if you also take a water pill or have kidney disease, ask your doctor or pharmacist which pain relievers are safest for you. You can ask, is ibuprofen or naproxen safe for me with my blood pressure medicine? And also, what should I use instead for joint pain or arthritis? There may be safer options for your situation, but that decision should be personal to you. The seventh thing to know is about dizziness when standing. This one may seem small, but after 70, it is not small. If you stand up from bed, the couch, or a chair and feel lightheaded for a few seconds, it can be tempting to ignore it. You may say, I just stood up too fast. And sometimes that is true. But if it keeps happening, it matters. Blood pressure medicines lower blood pressure. That is the goal. But when you stand up quickly, your body has to adjust fast. Blood has to move upward. The heart and blood vessels have to respond. The brain needs steady blood flow. If that adjustment is slow, you may feel dizzy, weak, or unsteady. And a few seconds of dizziness is enough time for a fall. So use the pause rule. Before getting out of bed, sit on the edge for a moment. Move your ankles gently. Take a breath. Then stand while holding something stable. Before walking away, pause again. Let your body catch up. This tiny habit may reduce those rushed, wobbly first steps that can be risky in the morning or at night. But if dizziness is regular, severe, new, or connected with fainting, chest discomfort, shortness of breath, confusion, or weakness, tell your doctor. Do not just keep living with it. Your dose may need review. Your medication timing may need review. Your hydration may need review. Or there may be another reason that needs attention. Now let's talk about home blood pressure readings, because this is where many people accidentally create anxiety for themselves. Blood pressure is not one fixed number. It changes all day. It can rise after caffeine, poor sleep, stress, pain, exercise, talking, rushing, or even worrying about the reading itself. One high reading does not always mean your medicine is failing. One low reading does not always mean your medicine is too strong. What matters is the pattern. Take readings the way your doctor recommends. Use the same arm if advised. Sit quietly for a few minutes first. Keep your feet flat on the floor. Do not talk during the reading. Write the numbers down. Then bring the log to your appointment. Patterns help your doctor. Panic does not. And please do not take extra blood pressure medicine because one reading scared you, unless your doctor has specifically given you that instruction. Do not skip your medicine because one reading looked good. Amlodipine, Losartan, and Lisinopril are not rescue pills. They are not meant to be taken randomly in reaction to one number. They are usually part of a steady plan. Know the pattern. Do not panic. Do not change it alone. That is the message I want you to remember. Know the pattern of your medicine. Know what symptoms to report. Know what symptoms are urgent. Know what questions to ask. And never adjust your medication without medical guidance. So let's quickly review. Amlodipine can be linked with ankle, foot, or lower leg swelling. Report it to your doctor, especially if it is new, worsening, painful, one-sided, or connected with breathing problems. Lisinopril can be linked with a dry cough in some people. If it is persistent, mention it. But swelling of the lips, tongue, face, or throat is urgent and needs emergency help. Losartan and Lisinopril may affect potassium balance, so ask before using potassium-based salt substitutes or potassium supplements. Vomiting, diarrhea, fever, heavy sweating, and dehydration can change the safety picture, so ask your doctor for a sick day plan. Over-the-counter pain medicines like ibuprofen or naproxen may not be safe for everyone on these medications, especially with kidney concerns or dehydration, so ask first. And dizziness when standing is worth taking seriously, because falls can change life quickly after 70. If this helped you, please like this video, subscribe to Sharp 50s, and turn on notifications so you do not miss future health guides made for adults over 50. And before you go, comment your age and where you are watching from. You can write something like, "I'm 73 watching from Ohio," or "I'm 79 watching from Manchester," or "I'm 82 watching from Ontario." If you take one of these blood pressure medicines, you can also write, "Checking my bottle," in the comments. That simple comment may remind someone else to look more carefully at their own medication list and ask better questions at their next appointment. One final reminder, everything shared here is for educational purposes only. It is not a substitute for personal medical advice, diagnosis, or treatment. Always talk to your doctor or pharmacist before starting, stopping, skipping, doubling, or changing any medication. Blood pressure medicine can be an important part of protecting your future, but the safest patient is an informed patient. So read your bottle, know your medicine, ask better questions, and never make medication changes alone. Take care of your heart, protect your independence, and I will see you in the next Sharp 50.